Hi everyone. So I'm a final year student midwife at University of Birmingham. I'm on a short course. I'm a registered nurse, but I'm an early career nurse. I first qualified as a nurse 2021, and I'm new in country. I came in UK 3 years ago as a nurse, and then I went on for this training because I was working as a nurse within maternity. That's what made me to pursue this. Leadership, as I will start with a quote about leadership. So as John C. Maxwell, if you have heard about him, he talks about leadership not being about positions, titles, or flowcharts. It's about one life influencing other. So the leadership today I'm talking about is not about the management. It's not about managing people. It's not about managing the budgets. It's about how we do advocate for ourselves, for other students, and for our patients, and how we can make the profession a better and attractive for newcomers at the top levels, from international to policy to UN to WHO and at the local level. So in today's presentation, I will basically be presenting Nursing Now program, which is a global nursing and midwifery leadership program. And I will be sharing my story, how through that program I developed my leadership capacity. So it will be something useful for all of you very early in your career to take advantage of and develop further if you want to have basic research skills, networking skills, and advocacy. Okay, so I will start with why leadership development is important in terms of patients. When we have leadership qualities, as to speak of, some people are like naturally confident, yeah, they speak very well, the thought process are good, but some people develop those skills over time with exposures, repeated exposures. So in leadership development, we have networking skills, we have communication skills, and we know that in communication, the words are only 8%. It's the tone, body language, and eye contact that makes your communication, right? So once we have that leadership capacity, we are better communicators, we are better at raising concerns, at educating for ourselves, and talking about the profession. So it improves the care quality for everybody, it creates a positive work culture, it drives innovation because empowered and confident midwives, early career midwives, are more open about having ideas and going and seeking, sharing those ideas with other people because they have the confidence. And boosting retention. So if you're a motivated midwife, you are more likely to stay in the profession because you're doing more than what you're asked to do. And in England, we have 43% resignation rate within 10 years of registration. So 43% people leave their profession within the 10 years, nurses and midwives. So why are they leaving the profession? Because of many factors, but also if they had that confidence, that support system, that mentorship, they would likely to be stayed. My story. This is a picture on the right. It's in Pakistan. I was a final year nursing student there when Global Nursing Now Challenge was launched. It is a program of Birthday Trust of Nursing, which is a UK-based charity, and they launched a global, revolution to raise the image of nurses and midwives globally in 2019, and they did a tour of every country, bringing all influencers together in order to educate for the professions, for better working conditions, for raising image and challenging health status quo, challenging the hierarchy, as well as to change the public perception about the profession. So they came to Pakistan as well. That's how I got to know about Nursing Now program. So I took a membership. Membership is free. I connected to this global community of nurses and midwives from all over the world. I started attending their webinars, their sessions, tried to understand how nursing and midwifery is actually different in other countries. Like in Pakistan, we don't have midwifery programs at all. We only have like diploma. We don't do bachelor's in midwifery. We don't do master's in midwifery, advanced midwifery practice. There are nurses who are working in maternity, but it's doctor-led care, just like in US. But when I spoke with Canadian midwives, when I spoke with Australian midwives, with United Kingdom, it was completely different. And then Africa is very, very good midwifery care there. So this increased and enhanced my knowledge, and it took me out of my small bubble where I was a student midwife in one hospital in one country. Then I had that big exposure of how the profession is working in different settings across the globe. And that made me understand that we are more than that what we're doing, and we have the capacity to do. So I started doing a lot of work in my own time, like attending these webinars and developing understanding, started to speak up. And then this is one of the things that I got as a leadership award, because I was very vocal about raising the profile of student nurses in my university back home, where we never had research opportunities for student nurses there. And we only had one module of introduction to nursing in our third year of nursing, which only included like introduction of qualitative and quantitative research. So I went to the professor and said, we need a research society, because the medical college always had it. And they were publishing before they even qualify as doctors. Why not we nurses do it? And I was told even the nurses don't have the opportunity when they're doing how we make the student have those opportunities. Because of my links and networks with Nursing Now program, I was able to influence it and form the first nursing research forum at our university in 2019. And now it's still there, and there were plenty of nurses and student midwives who have published before they graduated, who are working as research fellows and interns in like University of Alberta at Johns Hopkins while being as a student. So that was the impact of taking that initiative, because I had the confidence and the idea and the networks to go and speak to that student experience office. So once you have that network and platform, you can do it. That's why programs like Nursing Now program and leadership development is very important for students. 2023, when I was qualified as only 2 years as a nurse, and it's my first 6 months within the UK, we got to be invited to World Health Assembly at World Health Organization. Here we had spoke about an intervention which was put together by 6 early career nurses and midwives from Africa, from Spain, from UK, from Pakistan, and we have people from Gloucester. I was here, I was representing Pakistan, but also UK at the same time, and then Kenya. We put it together, and we did say it in front of like all health ministers of the world. This is where they've put a strategic direction of nursing and midwifery report, which was released this year, and then it has recommendations how to influence the profession. So that was the power of being engaged into this program as a student nurse. We recently got featured in Nursing Times magazines. That was January 2025. So these are the nurses we can see are part of the program. Lincoln is a learning disability nurse from here in England. I don't remember the town. And I was working as community health nurse within antenatal clinic in UK. We have Zifi in the front. She is a Kenyan nurse. And then we have Amy Stelly. She's a nurse from UK. New York, and then Stephanie with the white coat, she's a clinical nurse manager. They all got their first clinical nurse managers post because they had developed policies and publications by being in this program. So they already built their portfolio when they were graduated within 5 years. That made them to get those higher jobs quicker because they already had leadership development in their portfolio. And then there were plenty, I don't have enough time, but I have spoken plenty of conferences. One is this International Quality Forum, which was in London last year. So here I go and speak the same thing which I'm speaking here, about leadership development of early career nurses. We have a video here about Nursing Now program.
The Nursing Now Challenge is a global community of early career nurses and midwives like myself.
It is this vast, boundless global network that is huge. It's immense, spreading from the Americas to Africa to the Western Pacific and beyond.
At its core, it aims to empower young nurses and midwives like myself to be leaders and drivers of change in our communities and in every level of healthcare that we occupy.
I cannot even put words to describe how powerful and how pivotal and influential this opportunity has been for me in my nursing career.
Joining the Nursing Now Challenge was a leap of faith and it turned out to be one of the best decisions I have made.
This experience has enabled me to network with other young nurses in healthcare to bring up innovative ideas.
This community of Nursing Now Challenge gives us a voice.
I've joined global discussions, moderated my own webinar series, connected with inspiring academics worldwide.
My colleagues like Sana, who shook the worlds of lawmakers at the World Health Assembly, and nurses like Lincoln, who are paving the future of our profession through AI technology.
The most important one for me as well is leveraging innovation to address those healthcare challenges.
Through the Nursing Now Challenge Global Solutions initiatives, courses like the Health Action Training and other webinars and workshops on global health issues, you get an opportunity to interact with global health leaders in different spaces.
Being part of the Nursing Now Challenge is really transformative.
It's transformative.
Transformational, profound, and innovative.
Nursing Now Challenge is much more than just an international collaboration network.
It's a movement that amplifies the voices of nurses and midwives.
One of the greatest benefits of the Nursing Now Challenge is the power of connection.
It is very special and it is very empowering.
It has been the best thing I've ever done.
Achieving universal health coverage and healthcare for all is actually possible, and we are making it happen.
The statistics are powerful, but the impact of the Nursing Now Challenge remains immeasurable.
So join us today.
Of time, I will be very quick. So we have more than 253,000 members all over the world, and it's just for early career nurses, midwives, and students. So if you are within the 5 years of registration, you can be part of it. And we have around more than 1,200 organizations across 156 countries as members, and it's free. You can just go into the nursingnow.org and you join and you become a member. You don't have to pay anything, but you will get all the free mentorship, networking, and opportunities as a member. This is our advisory board for Nursing Now, and they are global nursing and midwifery leaders from across the country. And me and Stelly are the co-chairs of the Challengers Committee. We look all the regions, and Hemi is a nurse, and I am a nurse and a midwife. We'll soon become a midwife next month, hopefully. And one recent opportunity for nurses and midwives in the UK we got is to be part of the CNO England Professional Strategy Working Groups. So every regional lead of Nursing Now program is co-chairing the working groups, and I sit in the advisory board of that professional strategy. So we are changing the narrative that you don't need years of experience to help and shape the policy and strategy if you know what you want. And as Gen Z, we have already showing it to all over the world how Greta Thunberg is leading the climate change, and the Gen Z has turned out their governments in Sri Lanka and Nepal recently. Malala Yousafzai, 17 years old, the youngest global Nobel Prize winner, and changing the students' educations and girls' education. So we can do it if we really are passionate and want to educate for our communities and for our profession at the global level. If you want to have your say in the professional strategy of England as student midwives, how you can improve and what you want in next 15 years, because this is a strategy of the future, you can scan the QR code and head your voices in it. This won't go into the actual strategy because it's closed, but we can still share your views to the CNO office. And this QR code will be in the next few slides, you can see it. I will be quickly winding up. So these are just some of the initiatives. So the QR code is still there at the corner if you couldn't scan it in the first slide. We have health action training, we have global solution initiatives, global book clubs, midwives in focus, mailing and nursing times. You can publish your blogs, you can be part of debates and grassroots podcasts and sustainability trainings. All of them are free for Nursing Now members. And though it's called Nursing Now, midwife is a big part of it. I sit in the co-chair. We have the African lead as a midwife in it. We have Dr. Sally Pizarro, who is leading the Midwife in Focus work within Nursing Now program, where you can be part of in publications and podcasts. And we had book clubs of involving midwife authored. So it's pretty much very well relevant to midwife and early career midwives. So this is the Midwives in Focus, and we actually made specific calls to outline the State of the World Midwifery 2021 and WHO Global Strategic Direction for Nursing and Midwifery. Nursing Now Challenge has been quite educate in that regard. And these are 2 publications has been published so far within Midwives in Focus work, and you can scan the QR code and see the work has been done with the support of University of Coventry. So you can connect to the Nursing Now program. These are our social media handles, and if you still haven't scanned the QR code for the professional strategy, you can do it now, and these are just 5 subjective questions, and that's all. Thank you.